Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele, presenting Health Equity Teacher, Part 2 of the Food Insecurity module. This presentation is Caring for the Food Insecure Patient. So in the previous presentation, we learned all about food insecurity, what it is, what predisposes or put patients at greater risk of experiencing it, what it looks like and its impact on a patient's health, and a little bit more about the cyclical nature of how it influences someone's management of a disease. This presentation takes it a step further and hopes to help you learn how to apply that knowledge in a clinical setting, actually learn how to assess a patient for food insecurity, and then address that food insecurity if it is present. So the objectives of this module is to describe a provider's role in assessing for food security and how they can do so, and identify resources that can address a person's food insecurity and apply them to a patient that identifies as being food insecure. That application part is included in your application exercises described on your syllabus. But to begin with, part 1 is assessing for food insecurity. So in order to be able to address food insecurity, you have to see if it's there in the patient. And you do this with screening. But who should you be screening? To make that decision, you should really use a patient's social history. It's a great tool in determining whether or not they have relevant social risk factors for food insecurity. The risk factors we spoke about previously, whether they have children, whether they, what they do for a living, whether they have financial stressors, whether they have had recent unemployment or things like that. So take social history into consideration when you're making this decision, but you should also definitely screen patients with a couple of different conditions. Obesity, diabetes, hypertension, weight loss, vague abdominal complaints, mental illness. Those are medical conditions, all of which that are tied to nutritional intake in different ways, and therefore are relevant with food security. You should also screen patients that are currently using safety net programs for food assistance, whether it would be federally funded programs for food assistance or locally based food pantries or food banks. You should also always screen people who have children in the household, as we learned that children are a significant risk factor for food insecurity. So we just identified who we will be screening, but how should you screen patients? There's a couple different ways. The first one we'll talk about is a quick assessment during patient intake. And this consists of reading the patient 2 statements and asking them whether or not these statements are often true, sometimes true, or never true. And the first is, within the past 12 months, we were worried whether our food would run out before we got money to buy more. The second is, within the past 12 months, the food we bought just didn't last and we didn't have money to get more. Both these statements with affirmative answers, so whether it would be often true or sometimes true, those 2 answers to these questions are considered positive, and they would lead you to dig deeper about that patient's food security or insecurity experiences. So this is just kind of a simple, very quick initial screening. To go even deeper, there's something called the USDA Household Food Security Module. And this is a little bit longer of a screening questionnaire, and it's more thorough because it asks several different questions about the patient's food security and the experiences they've been having. In the module materials, you'll see a PDF, both English and Spanish versions of this screening tool that has all the questions. I won't go into detail on those, but you're looking for affirmative yeses. So yes, often, sometimes, almost every month, and some months, but not every month. Those are the affirmative responses, and those give the patient a point for their score. And then you take the cumulative score to their answers of all these questions, and it'll give you a description of their food security. So just like we talked about in the first presentation, food security is a spectrum, and the scores will fall somewhere within that spectrum. And you really want to be looking for scores above 3. So 3 to 7 and 3 to 5, depending on whether or not you have children. indicate low food security, and then above 8 or above 6, whether you have children or no children, indicate very low food security. So again, the household food security module is a more thorough questionnaire that will give you a better screening for the patient's food security status. So say a patient scores 3 or above on the module survey, and now you have to address this patient's food insecurity. How do you do that? So the first step is working with the patient. As with all of our clinical encounters, we strive for shared decision-making with the patient. And so you really want to make it a collaborative experience. You want to educate the patient on the importance of access to nutritious food to that patient's health. Really empower them to use healthy eating as a way to manage their health. You also want to get to know the patient's specific food insecurity experience. Have conversations with them about how their food insecurity has forced coping mechanisms and how those specific coping mechanisms of the patient impact that patient's health. So talk about the quality and quantity of food. Talk about whether or not they've been adhering to compliance with that patient's treatment plan, their medications. Really get to know how food insecurity is affecting that specific patient. You also want to revisit a patient's medications. Medications, some are very sensitive to food intake. For example, someone with diabetes taking medication to help them reduce their blood sugar, if given in a period of time when the patient doesn't have access to a lot of food and they already have low blood sugar, that medication could be very dangerous. So you want to talk with them about how their medication routines should change whether or not they are food secure or food insecure, whether they have food or whether they are not having reliable access to food. And if the patient is not adhering to their medications because of food insecurity, consider adjusting that patient's medications for more optimal adherence given the patient's financial and behavioral circumstances. Again, we want to meet the patients where they are at and make sure that we're treating their medical condition while considering the impact that food insecurity has had on their life. And additionally, if the patient does have smoking or substance use habits, counsel and work with them on to educate them on its role in eating up someone's budget and its role in exacerbating food insecurity. So that's all the collaborative experience with the patient. And you really want to make sure that they're involved in the decision making as they're the one that's acting out the treatment plan. In addition to working with the patient, you also want to help the patient get connected with food security resources. There are several food security resources out there for these patients to use, but a lot of them don't know how to access them, how to apply for them. Some may not have the resources to technology to apply for them or the health literacy to do so. So your role as provider is helping to not only connect them to resources, but make sure that they're confident in using them and providing them or connecting them to assistance to get the applications done for these resources. One option is community-based resources, and these include local food banks, local farmers markets that can help patients get more local access to fresh produce if they're potentially located in a food desert or somewhere without a reliable fresh produce section in the grocery stores. And here I have listed links. There's also a tools for connecting patients to resources document in the course materials where you have all these links and descriptions of them. And the last community-based resource is calling 211. 211 is a great resource to call and connect patients not only to food resources, but so many other community resources. So don't be afraid to give that number a call. Beside the local level, you can help connect patients to state and federal food assistance programs. So these are programs that can either help provide food at a reduced price or free of cost, depending on the program and the patient. There's one called Supplemental Nutrition Assistance Program, frequently called SNAP. It used to be called food stamps. There's also one specific to women, infant, and children, abbreviated WIC. And so depending on which your patient fits into, you should be knowledgeable in how that patient can apply, how they can see if they're eligible, and where they can find all this information. Be the patient's guide in these. And coming up next, we'll talk about how to actually do that. I'm going to demonstrate. But before I do that, I just want to emphasize that these programs may not be able to fully eradicate the food insecurity from your patient's life, but it can certainly help to reduce the depth of the food insecurity and really help take the first step in managing your patient's health conditions, as we learn that food insecurity has so many health impacts for patients. So now I'm going to do a demonstration of how to connect patients to resources. I'm going to be using the Tools for Addressing Food Insecurity document, which should be in your learning materials folder. And so what I have here is all those links that I had in the PowerPoint presentation, and I'm going to just walk us through what they provide and how to use them so that you actually have an idea of how to use these in real life with patients, because that's the goal of this module, not only to know about these social determinants of health, but how to address them in real time. So this first one is the USDA Food Access Research Atlas. This is a great tool for looking at a visual map and finding out whether or not, based on your patient's residence location, whether or not they live in a food desert or an area with very low food access. So you're going to click on the link and then choose Enter the Map. And you'll find a map of literally the world. And you're going to zoom in on the area of interest. So say we are looking in Connecticut. You can also Google up here. So if I Google Farmington, Connecticut, it's going to zoom in on the area. And then you can, here we have a color-coded map. You can choose different criteria for seeing different levels of food access. And as you can see, Farmington itself is not very problematic, but then you go out and you see that there are local nearby food insecure areas based on census data. So this is just one tool. You'll see on the side you have color-coded different areas you can add for different levels of food access based off census data. That's one tool, just giving you an idea of whether or not your patient's at risk. These other resources, though, go into how to address the food insecurity with your patients. And first, I have local food banks. Again, these can provide food free of cost to your patients typically. And these are two different websites on how to search for ones. So going to Feeding America, again, you can search, I'll search the zip code, that's for Farmington. And here we have one Feeding America bank. And here it gives you the resource, the website, and you can click Find Food, very easily to find a local resource for your patients. Another website that's very similar is foodpantries.org. And again, there's different states. So say I'm looking at Connecticut. you're going to look, and there's plenty. You can go by town and then say I'm looking at Bloomfield. Here we have listed out all the different food pantries organizations. So you can work with your patient to find options in their community that they'll be willing to use. A great option for local fresh produce to both support local businesses and provide fresh produce to food insecure patients that may be easier to access is farmers markets. And here we have a directory, which is pretty cool. You can search by zip code, and then you can also filter to payment accepted and choose whether or not they accept SNAP, WIC, different programs. So not only are the patients getting local fresh produce and healthy things in their diet, but they can also get it at a cheaper, reduced price. So again, you just enter the zip code. So again, I'm going to put 06032 for Farmington, Connecticut. I'm going to hit mile, I'll do 10-mile radius. You're going to search, and there's 3 here. And then if I wanted to filter even more, I'd use the SNAP, and 2 of them accept SNAP. So again, a great resource is you can filter by different products, locations, whether it's winter season. Great resource for connecting your patients to fresh produce and other fresh local goods. And lastly, I'd like to discuss how to connect your patients to their state's SNAP application information. So this website right here is a SNAP directory, and it'll give you state-by-state information by selecting the state you're in. So again, I'm going to use Connecticut as an example, and we're going to go to Connecticut. It pops up. It'll give you their website, phone number, office, applications. So I'm going to go to online application because I want to help my patient apply for SNAP in Connecticut. It takes you to the Connecticut specific website, as it does for other states. And over here on the right side, you can see whether you can use different resources to actually apply. The patient would have to make an account to do that. But you can also walk your patient through the website to see if they're eligible. And I'm not going to walk you through the whole process, but you click that button and you walk the patient through entering different personal information. Nothing too personal, just who's in their household, what are their financial information and their assets, potential disability, things like that. And it'll tell you at the end whether they're available, whether they're eligible for not only SNAP, but other forms of aid, like Husky coverage for medical insurance, but it will tell you directly whether they're eligible for SNAP in that state. And it's not just Connecticut, but again, the directory has things for all 50 states. So that would be the demonstrations of how to connect patients to resources, and that finishes up our 2 video modules for our food insecurity social determinant of health unit. Thank you for listening.